I'm amazing, especially because I'm here with you, my wife. Every time that you go outside of the country and you spend like 12, 18 hours sometimes in surgeries and procedures and trainings and all that things, expat patients dramatically changed all our outcomes. We have a book coming next year. We have, I believe it, around 10 papers already published in the most important plastic surgery journals. The facelifting is something that makes me really happy. My new facelift, the deep plane, the deep neck, it's something amazing. Now you know what's the problem, because here in UAE, most of the patients, they try to overcorrect their face by using additional fillers. And the permanent filler is the only sad thing that I do, because I really don't, not that I like the surgery, but I don't like the histories behind that. Because the permanent fillers, most of the patients, they are suffering and their life are in risk.
We are here to talk about the new trends of plastic surgery here at إليزيه Hospital. How are you, Dr. Paulo?
I'm amazing, especially because I'm here with you, my wife.
Good to know. So I have special questions for you again. Okay? Every time I open my Instagram or WhatsApp group or everything, many friends, many patients or new patients or our audience, they ask about what are you doing new, what's the new trends, why Paulo is traveling so much abroad, what have you been doing outside the country, doctor?
Okay, there's many things that happen at this moment in the plastic surgery field and all these new techniques. I have been traveling a lot to bring most of these innovations and the new surgeries and the new trends here to UAE. Today we're going to discuss a lot of things. We're going to discuss about the rib remodeling, the deep plane, the deep neck. We're going to discuss about the filler removal, okay, special ways to do a new waistline for the patients with the internal corset and many other things.
Okay, so first, I would like to ask, how do you select the training that you will be attending? How does it get to you? Like, oh, this one is more suitable for me or for my patients? How do you decide?
My trainings are based on to try to find what I have the best available in the world nowadays. I know most of the most important plastic surgeons in the world. I have been studying all these guys. So whatever I discover that they are doing some special trainings, I go there, I learn all the tricks, all the details, and then I can bring it here together and put with the things that I have been doing, improving our surgeries.
So you consider that exchanging experiences and training other people also, it's a way to learn?
I think definitely. Every time that you go outside of the country and you spend like 12, 18 hours sometimes in surgeries and procedures and trainings and all that things, we become not only professor and student, we become like personal friends, and we start changing experience, not only about the techniques but many other things. So most of that it's related about new techniques, but in the end the communication between both sides, to giving, look, it happened to me and I did it like that and I got better result. You start learning a lot. I have been learning many things, from the most important plastic surgeons in the world. When you put everything inside of a bucket and you mix it, you have new products, you have things that has happened that is much better than what I have been doing for 5 or 10 years back. So I think that is extremely important, that you never stop sharing the information and never stop studying.
And how do you consider, like, okay, this works for our patient in UAE, this one works only for South America patients? Is there any difference between the public of these countries or regions?
Well, it's really interesting because here in UAE, we have a mixed population. We have 85%, I believe it, from outside of the country, expat patients, something like that, as far as I know, So we have here a mixed number of patients. We have patients from South America, from North America, from Europe, from Asia, from many other countries. So in here, it's a place that we can check and use all these techniques. I'm going to give an example. One thing that is really amazing in this country that's been working a lot and give a lot of improvement for our surgery, it's the rib remodeling. Why? Because the patient gets enlargement of the rib cage after having several babies. And to have several babies like 5 or 7 is not common in South America, but it's pretty common here in UAE. Patients here, they have a lot of patients. And because of that, or some patients, especially here as well, they are overweight, they have an enlargement of the rib cage. So when the patient get pregnant, it has an enlargement which is going to make the patient feel more squared and not having the contour that they had before the pregnancy. This technique of the rib remodeling was something that I learned, years back. I was one of the first in the world to start doing that. I'm the first here in all the Middle East doing that, and dramatically changed all our outcomes. And it got amazing because by the time that you just put the lowest ribs back on position, it's not a removal. And I went outside to learn how to do that without removing anything, to give the patient back her natural waistline. So when you just put them back on position together with the internal corset, our outcomes improved thousands of times. I'm in love with all my patients now at this moment, since that we started applying these techniques of the rib remodeling, which I believe that changed all the game in plastic surgery.
I would like you to talk about the research and the articles published, because some patients, they don't believe the remodeling surgery. They think it's some trend. They think it's something like experimental. Can you talk a little bit more about the research and the articles, the scientific articles that's being published?
Okay, there's a lot of misunderstanding about rib remodeling. First of all, in the past, most of the patients, they had done rib removal, which is definitely something that we don't recommend at all for our patients. Rib removal, when you remove a piece of the ribs, and definitely that it's gonna get damaged, you're gonna have a lot of problems. We have been developing the rib remodeling, which basically is the same concept as a rhinoplasty. So for example, if you never had done a rhinoplasty, maybe you know someone who had done a rhinoplasty. Rhinoplasty, basically you have two options. Or you're going to remove everything here, which is the rib removal, and it's going to sound really artificial, not nice. Or you're going to just put them back on position and narrow, but still have everything here to protect. That's the rib remodeling as well. So we have been doing a lot of studies. The most important plastic surgeries, studies in the plastic surgery, that is our magazine that we call it, the studies, it was created by me and some friends, who had done this procedure for a long time. And we have all the data and all the things to prove that this is safe for the patient, that improves the shape of the patient, that is the correct way to do. So all the most important techniques was developed here inside of إليزيه as well. So I'm pretty happy with that.
Oh, that's great. That's great. And later on, we're going to mention where this information can be searched, okay? Because I think it's something that the patient feels more safe when they go to search for some information, and they get the real information, the scientific.
We can put that. We can put that in our social medias as well. I think it's nice
There's a book article that we developed.
Yes, we are writing a book at this moment. This book, it's a special book about plastic surgery. This book, it's under my coordination, and it will be launched, I believe, in March in 25. This book, I spoke directly with all the most important plastic surgeons around the world, and everyone is going to help to write a chapter about the advances in plastic surgery. It will be the most important plastic surgery book already launched in the world. So it's under my coordination. I think it's going to be really great. I'm really excited about that. For the first time I'm writing a book, It's not an article, this time is a book, dedicated for body contouring. Everything about the breast, everything about the tummy, everything about the buttocks as well. So in terms of studies, in terms of, research and everything, we have a book coming next year. We have, I believe, around 10 papers already published in the most important plastic surgery journals, which talks about the rib remodeling, talks about many other things, especially one that we have been discussed yet, that's the full body remodeling minimally invasive, where we can get everything done. Instead to have the traditional scar for the tummy tuck, we can do everything by the same liposuction incision, with the video instruments, and everything guided by ultrasound.
Am I a good candidate for this or not?
The full body remodeling minimally invasive, it's a really nice procedure for majority of the patients. Not all the patients. It fits better for those patients who doesn't have additional skin. So patients that, for example, in the past, because of several kids and maybe lose that much weight, there's a lot of patients that has a lot of stretch marks and loose skin. These are good candidates for tummy tuck. But for the last years, we have a lot of patients that they like to go to the gym, they take care of themselves, and they don't have loose skin, but they have the muscle diastasis, for example, or they have the minimal loose skin. These are the perfect candidates for the full body remodeling minimally invasive. In this procedure, what we have been doing, it's a full liposuction 360, front, lateral, upper back, lower back. The same fat, I'm gonna use it to do fat transfer. The same fat we can use to inject inside of the muscles to create a better shape for the tonus, a better tonus for the rectus abdominal muscles, guided by ultrasound. So we use the ultrasound in the moment of the surgery. Together, we create the rib remodeling in this procedure. So we give the shape back to the patient by rib remodeling, by connecting the muscles, by doing everything by ultrasound, and by doing everything by liposuction incisions, which is 0 point something millimeters, something. It's pretty small, and everything done by video without having the traditional incision for the tummy tuck. That's amazing, and that's the first case done in the world. It was here at إليزيه with us. So we have been creating this procedure, and I'm pretty happy about that. Next week I'm gonna be in Singapore showing to the community of plastic surgeons there how to perform that, and I have been traveling around the world as well, showing this how to do. It's amazing.
What was the most important seminar or training that you consider been doing for this past?
I don't have one special.
Have a favorite one?
No, all of them for me.
I thought your wife. I thought it should be the face, because I do love the way that you do facelift.
Yes, it's true. But for example, all the trainings for me, they are special.
Because my mother was your patient.
Yeah.
Before our...
I love to do the facelift as well, but just to talk about the trainings, for example, all the trainings for me, they are special because I share information with all my colleagues. But for example, the trainings that I have been doing in facelifting, the deep plane facelift, it was amazing as well. So I don't have any special preference for none of them, but I love everything.
So you don't have a special kid, a favorite kid, right?
No, I don't have a favorite kid. I like all the search. No, I like all the search that I have been doing. All the search that I love it, everything, But for example, the facelifting is something that makes me really happy. My new facelift, the deep plane, the deep neck, it's something amazing. Because, for example, in the past, okay, and I've been doing this search for almost 20 years. In the past, the old techniques is basically skin removal, which gives the fake look. It sounds like there's a wind on your face, and you get really strange. I think that's ridiculous. Doesn't fit anymore here. The deep plane, it's pretty amazing because instead to just pulling the skin down, back, you're gonna correct the muscles. And you go to a deep plane so you can pull the muscles instead to pull the skin, which is going to give a much more natural shape, a much faster recovery, a much more natural look for the patient. So we have the deep neck, the deep plane. Also, we have the deep neck, which means for those patients that has a big neck here, we can do the ultrasound in the moment of the consultation to double check if this is an external fat that can be done by liposuction, or if this is an internal fat that needs to be removed and correct the muscles by giving a new neck. And the neck, it's amazing, it's beautiful. It's really great. So the deep neck together with the deep plane, it's a minimal incision as well, which gives more natural results, and faster recover, and change the way that works the facelifting. It's excellent. It's amazing.
I love face surgery.
Yes, it's really good.
I love face surgery because you can. I think there's. cannot say there are more things to be done. At a certain point, the patient thinks that, oh, I already did my facelift. It's halas. I don't need to go for fillers, for Botox, for peeling, or everything. But it's something that you can go even further and further, in your opinion.
Now, you know what's the problem? Because here in UAE, most of the patients, they try to overcorrect their face by using additional fillers, which is a mistake. You cannot put additional Botox or additional fillers to try to overcorrect your face instead to go for a deep plane, for example. There's indication for deep plane, there's indication for fillers, there's indication for Botox, okay? You have to find a balance. So I know that you have your preference about some surgeries, you know, but for me, you know, I really believe that by all the surgeries, I like all of them. You know, I like my tummy tucks; they are amazing. I really love that. I like my breast surgeries too much. You know, I think they are great. The face surgeries, it's beautiful and nice. You know, even the permanent fillers removal, we have been getting really good shape and really good results at this moment. So all these procedures, I don't have one special. Maybe the one special that I love the most is the rib remodeling. I think that this is a little bit more on my heart, you know. But overall, I like everything. I like to be in the OT. I like the surgeries that I have been doing.
Do you like difficult cases or easy cases?
Depends. Depends. I'll be honest. Depends, because, for example, as a challenge, as a surgeon, difficult cases are amazing. You want to get a difficult case. You want to solve the difficult case, you know, because then you can see that you get some step forward, you know. So I love a difficult case. But at the same moment, I'm a human, you know. Of course, that easy case, it's nice because it's easy to solve it. But my heart, I think, that talks more about the difficult case as a surgeon, the challenge that I pretty love that much, you know. But my human side says about it to be on the easy case. So anyway, I like to do my.
Mm-hmm. And talking about the internal fillers,
the permanent fillers.
The permanent fillers. Okay, I know that here they don't broadcast a lot the damages, the disease. So as you were outside of the country and doing some training, can you mention some?
Yes, I went to Colombia to meet the guy that has the biggest experience in the world about permanent fillers removal. And the permanent filler is the only sad thing that I do, you know, because I really don't, not that I like the surgery, but I don't like the histories behind that. Because the permanent fillers, most of the patients, they are suffering and their life are in risk. And it's really sad every time that you have a patient like this in our office, that we see the suffering on their face, we see them cry, you know, we see that their life are in risk, and that is really sad. So I went to Colombia to learn the most advanced technique to remove these permanent fillers. Permanent fillers, it's a disease, and most of these products are illegal products injected by non-professional doctors. It seems to be easy, it seems to be cheaper, it's a magic solution. You just inject something inside of your body and you're gonna have the most beautiful and buttock shape forever, which is not the reality. There are patients dying because of that. There are a lot of complications, and once that you start having complications, they are permanent. Every time that you inject a permanent filler, you are inject a bomb inside of you. You're gonna die because of that one day, and that's gonna be part of, you know, of the problems. So again, if I'm thinking about all my surgeries, it's a public health issue, you know. You know, the history behind that is really sad, because here in UAE, I'm talking about my experience in UAE at this moment, you know. These patients that have been injected these permanent fillers and these illegal products inside of hotels, you know, inside of not even a medical doctor, professional, you know, someone who comes around the world from just to go to a hotel and get some industrial silicone, you know, other products that injected inside. These patients, they are suffering. These patients, they have a lot of problems. We have been helping them as much as we can, you know, But I think that that's the only sad part of my job, when I see these people suffering. Because when they come for breast augmentation, we don't have the same. When you have unless it's a reconstruction or a secondary case that someone had done a tummy tuck in the past and there was a really bad result and you come here to correct, we listen to these bad stories, But permanent filler is 100% of bad stories, Non-successful surgeries that have been correcting, which represent about 30 to 40% of our surgery, to happen sometimes. Because people started doing these surgeries, for example, like a tummy tuck or breast augmentation, in the cheapest places as well. Nothing against to be cheaper, the procedure, but as much as you want quality, as much as you want to get the best products, they have a price for that, they have a cost for that. And you cannot have a good shape and a good result by using bad products, So today, 40% of our surgeries, it's about corrections, from previous surgery. And doing the wrong selection in the past by choosing the wrong doctor, choosing the wrong hospital, or not following the post-operatives and whatever is going to happen, it's going to cost you a lot in the future. It's more difficult to fix it. It's more complex to fix it, and that has been one of the challenges that we have been facing with our patients.
We need to put the patient in the right track after a bad experience for them not to suffer another bad experience, right?
Yeah, definitely. I think that to prepare the patient, and we have been doing that great at this moment, this preparation for the patient, it's pretty important for us, The surgery by itself is not only the surgery, it's not only cut the skin and give some stitches. That, to be honest, is the minimal, The most important, I believe it's about the preparation that I have been doing for the patient. So we start with the bioimpedance scale, where we can check everything inside, the internal fat, minerals, many other components inside. We check the whole history of the patient. We adjust medications. We adjust the weight before the surgery. And after that, we check with the ultrasound what you're can remove it, what you're not going to be removed, how is the thickness of the muscles. So there's so many things happen before the surgery, which is so much important, which is so great, that dramatically going to affect the shape and the outcomes that you're going to have later. And I think that you have been working for me for many years. You have been doing this great, this preparation of the patient. You have all this training for that, for the plastic surgery, functional plastic surgery, And I think that this dramatically changed everything to us. It's much better, in terms of general aspects, what we can get for the patients.
Oh, good. And then about the let's talk about the fat transfers. When the patient asks for frame surgery,
I'll be honest. I'm the surgeon from the natural way. I don't like anything artificial. I don't like big buttocks. I don't like big boobs. I don't like anything. I can do that if the patient do the request for that, But there are much more patients looking for natural aspect than to look for the artificial look. Most of the patients, they are afraid to come to me and think that, look, he's going to put for me a big boobs, he's going to make to a different person. No, I want to make you be the same person that you are, but in a better way, So I think that the mistake that majority of the people thinks that any plastic surgery or all the plastic surgery is going to create artificial look, That's ridiculous, because I like the natural way. I like to work in something that the patient is going to feel comfortable to her abaya, to her clothes, to her family, So if you do not ask anything to me, I'm going to create a natural way. Beautiful, nice, really nice shape, really nice contour, feminine, sexy, without being vulgar, let's say. Okay? If the patient wants to get, look, but I want artificial, can I have that? I know how to do. I'm a plastic surgeon. Under the request of the patient, I can do that, because in the end, I'm going to respect what you want. If you want natural or artificial, I'm going to respect. But if you don't know what you want, I'm going to work in the natural.
Okay. So first the patient needs to decide what she's or he's been looking for, right? It's not a good way to bring someone to talk for you about what they need, what they want?
The worst thing is to listen what the other wants. I think that the patient needs to know what they want. We need to respect first the willing of the patient, what she wants, and then we can do that. Okay? I think that usually majority of my patients, 95%, they come to me and say, look, I want this. And that's amazing. I want to understand what she wants. Okay? But I have few patients that they come to me and they say, look, I don't know what I want. Let me ask to my husband, or let me ask to my mom, or what else, my friends, These are not the happiest patients, because if they are not happy with their body and they don't know what they want, and they are trying to make the others happy, I prefer not to do surgery, to be honest. I think that this is going to be artificial, this is not going to be nice, Definitely, this is not a patient to me, My patients are those that they know what they want, and I'm going to create as much as possible.
And what about the new techniques for the scarring, for the new machines that we are being...
In terms of new machines, we have here, not exactly new. I have been working with Vaser for many, many years, I believe that only few doctors here in UAE works with Vaser.
Yes, you're the only one here at the hospital.
In the hospital here, I'm the only one working with the Vaser. Vaser is one extremely important machine that I have been using for our patients that helps to get a better definition, better liposuction, better details. The second one is the plasma. We have here the plasmas available like the helium plasma, the J plasma, argon plasma. We have all these plasmas available here that I have been working a lot, and especially in the full body remodeling, minimally invasive. We use all these technologies. Combining with the plasma, we have the Morpheus, which is a micro needling. This micro needling makes the whole difference when combined with the Vaser, when combined with the plasma. So in terms of technology, we have here all the technologies available. We have here the power-assisted liposuction, we have the Vaser, we have the plasma, we have the Morpheus, and I have been using all these technologies during the surgery as much as I needed. This is about the technologies, but we cannot forget a different technology that is pretty important. For example, the kind of suture that you use it to close and everything, to make a nice scar, it's a technology. And there's a different brands for that. There's a cheaper brands and there's the top brands. And you only use these high brands that has the best technology. On top of that, another technology that is important that we have been using for all our patients, the surgical glue. The surgical glue is much better nowadays than it was in the past, and another technology that you put on top of that. And on top of that, the technology for the post-operative recovery. In terms of technology and creating new things and developing, we are surrounded by everything that we needed. The most important things available in the market nowadays, we have available here for our patients.
Oh, that's great. So Élisée Hospital is ahead.
Élisée Hospital has been to me, something in my heart, because it's a place that let me work in the way that I believe it. It's pretty nice. It's a place that they don't push to you to do what they want. They let you to work in the way that you want, And I have a really high standards for safety and for quality and for the technology that we're using. So Élisée, to me, it's extremely important. Definitely, I have no words to talk about that, because it has been the most advanced plastic surgery hospital in the whole UAE. It's a brand new. Everything here has the top safety quality as possible. They let me work and create the things that I want to my patient, to bring all these technologies, to bring all the new techniques, And I have been working in other places before, but only Élisée got me this opportunity, And I'm pretty happy with that.
Oh, good. So thanks. And do you want to say something about our beloved anesthesiologist?
Our team of anesthesiologists, not only the team of anesthesiologists, which is amazing, and I have a special feeling for them, I think that our team of anesthesiologists, it's great, it's amazing, are the guys that also make a huge difference in terms of quality, in terms of safety, in terms of take care of the patients. They are amazing, but as well the nurses. And the whole team inside of Élisée. When people look to us and say, look, you are guys that has a lot of success, success. I don't think that the success depends only on us, because I'm the guy playing in a team, you know. And like a football team, you don't play together alone. You have to play together. So behind me, there's plenty of people, you know, that has their responsibility as well. Our team, it's a really big team, you know, and it's amazing. I love the whole team. I love all the places that I work. I love the team that I've been working, you know. It made a lot of difference for us. And when you work in the other hostels, we didn't have that, you know. And now we can have everything here inside of this, let's say, big bucket.
Yeah, so it's very important for you to go home and feel safe, think that your patient is well assisted, and we provide everything that he or she needs for the recovery. And what about the post-surgery requirements? Like, can you talk a little bit more for us, like garments or?
Definitely that's going to depend on the kind of surgery they have been doing. But nowadays we have a whole team to do the post-operative for our patients. We have the garments, we have a full set of garments, we have special corsets, we have special foams that goes inside of the garment. We have a whole protocol that we have been using, you know. And definitely to take care of your post-operative is one of the most important things to have a good result. A good result comes from a good pre-operative. You have to have a good preparation for this patient. If the patient is not correctly prepared to the surgery is not going to happen fine. So you have to have a good preparation for this patient. You have to have a good surgery, you know, done, you know, less techniques, all this technology and everything that I have been talking. But also you have to have a good post-operative care. You know, the combination of a good pre-operative, the surgery, and the post-operative, it's the secret. Wherever you skip these steps, whatever you are doing wrong in these steps, there will be a fail later, you know, and there will be a bad outcome, there will be a bad result, because something was missing in this part. In here, we have the whole team for everything. You start with the pre-operative to the post-operative.
Oh, that's great. Let me ask you a special question. Like, would you like to change something on you?
I had done a hair transplant, you know. I had lost a lot of weight recently, you know.
How do you feel?
I feel really great, you know. As a patient, now I can talk as a patient. That was something that was disturbing me when I was losing hairs. And now become a trend between among men, you know, for example, to do a hair transplant. It was really great, you know, much better than before. So I can understand when the patients, they come here with certain kind of feelings that they don't feel nice and they feel ashamed, because I was feeling that as well, you know, in somehow. It was something that was disturbing me a little bit.
So it brought back your confidence somehow?
Definitely. Much better. Look my hair. Look my hair.
So do you brush your hair every day now, so it falls down?
The most important, I think, that look, I gave the next step. You know, I was sad with my hair condition, let's say, in that moment. You know, I gave the next step. So I feel when the patient, I feel quite similar. I can understand the patient when they come to me for the first time. They feel ashamed, they feel sad about their bodies, and they want to get some change. And now I can understand when they come to the post-operative with us and they say, I'm really happy, you know, you changed my life, you know, because in somehow, sometimes small things can make you feel much better, you know.
I remember that when you were recovering, you look at me and say, maybe it didn't work for me, maybe it's not, you weren't aware of the...
I was concerned about the beginning, and again,
yes,
I fully understand my patients when they are in the first 2 weeks, for example.
So
That's
you
the
saw yourself...
I saw myself like a patient, you know, in the other patients, because, for example, when the patient does a liposuction, for example, and they don't have the perfect shape in the first 2 weeks, of course, they have a lot of swelling, there are many things to happen. And they start saying, look, maybe it's not like I want, this or that, but they have only 2 or 3 weeks, you know. And I passed through all of this in the beginning, because a nice outcome, for example, it's gonna take 6 months, 1 year, 1 year and a half. You know, I have been doing my hair transplant 6 months ago. It's amazing. Now at this moment, it was not good in the first 2 to 3 months, you know, because it was growing the hair and all that things, you know. So I passed through everything that a patient needs to pass, you know, and it was great because it's a nice experience.
So you are experienced.
As a patient and as a doctor, yes.
Good to know. Okay, and then what else I should ask you? You want to say something?
We didn't talk about the breast implant, for example, that we have also the last breast implants available and the last technologies, you know. I think the breast implant, it's amazing. So let's go. I'm going to give a quick review about everything that we have been doing. First of all, from head to toe, you know, we have the new techniques for the forehead lifting, which is amazing, minimal incisions, and can help a patient that has the eyebrows inside of the, you know, globe, let's say, you know, so the forehead lifting, it's amazing, minimal incisions, which is great. The deep plane facelift, we discussed it before, great results, fast recover. We work in the preservation deep plane, which is amazing. The neck, the deep neck, it's beautiful and nice to give the shape and the contour by reposition the muscles, removing the internal fat, which is great. We have the rhinoplasty minimally invasive that has a faster recovery and don't need to use the cast. You know, also it's a great combination to do everything together with the face. You know, we have the gynecomastia for men, you know, to remove the glandular tissue in here without having any incisions, because it usually has an incision around the nipple, which is great as well. We have the breast augmentation with fast recover using the most advanced implants, the safest one in the market. This breast augmentation fast recover has the minimal downtime as possible, and the patient has free arms to do everything. I love this surgery. It's a surgery that takes 45 minutes and the patient discharges 1 or 2 hours later. I have been doing all the trainings in South America for the short scar mastopexy. So instead the patient has the scar that goes in all the breasts when they have a lot of sagging skin, we can get that in the minimal scar as possible, which is great. Or it to be like a L shape, or to be like a lollipop, or to be the minimal T as possible. We have also of that this procedure, it's a faster recovery procedure and the patient is discharged the same day. We have the new technology in liposuction that I have been discussing before. We have the full body remodeling, minimally invasive, that is everything done by under the video surgery, which dramatically change everything that you know about body contour and everything. We have what we love it, that is the rib remodeling. Rib remodeling is the best procedure ever. I love that, and all the patients dramatically change in a good way, in a good scenario, the contour. We have the internal corset that I have been creating and developing to improve the shape and correct the muscles, you know. And you have the fat transfer guided by ultrasound, which increase the safety level, you know, for our procedures, making the fat transfer now something that we can trust and without having complications for that. That is a quick review about everything that we have been working hard in the last years.
Yes, and we are preparing some for lipedema as well.
That's great. We have the lipedema, yes. It's so many things. It's so many things happen at the same moment that sometimes we forgot one or another. The lipedema is great. You know, people who has lipedema, that it's the accumulation of fluids in the legs. You know, we have been doing the clinical treatment, and we have some personal friends that have been doing for this treatment, and you can see the dramatic changes about the legs. Most of the patients, they just think that they have a liposuction done because they have fat, and when in reality they have the lipedema. And if they do not do the correct procedure, they're going to have a worse scenario. So the lipedema is, yes, it's our next surgery as well that I have been doing, you know, and also it's been changing everything that you know.
Mm-hmm. What are the devices that can be used on lipedema surgery?
On the lipedema surgery, basically I use all the devices that I have for liposuction. I use the Vaser, I use the power-assisted liposuction, I use the plasma, I use the Morpheus, combining this technology. But it's not only using the technology, it's know how to use the technology. Because if you take this technology, you have to compare like a Formula One car, you know. If I give to you a Formula One car, or to me, we don't have any experience to drive this car, possible, we're gonna crash and you're gonna have complications because of that. Okay, it needs a special training. It needs to get a team that know how to deal with that, because you use this technology, they are amazing. But if you use it in a wrong way, it's a disaster, you know. So the most important is not to have the technology, but to know how to use the technology.
Yes, that's right.
But now I have a question to you, okay? You have been working with me for many years, and you have been working directly with the patients, you know, doing the preparation for the surgery, okay? How do you see this preparation? How do you feel that now, compared to when the patient didn't have any preparation before?
Yes. I would like to make a comparison, like you've been traveling, like the preparation for a surgery is like this. You prepare yourself to go for a winter vacation,
Okay.
with a suitcase full of summer clothes. When you reach there,
And it's a winter, and you have only summer clothes.
and there is a heavy winter, you're gonna miss your coat,
Yes,
your boots,
I got the point.
your scarves. So I prepare my patients, like I need to see what they are doing, what they are doing in a right way or in a wrong way, to start doing the simple things, removing the artificial food, the fast food, the seasons, everything industrialized, some medications that I will not mention here because
Yes, definitely. I understand. You are preparing the patient, correcting everything they are doing wrong to have a better result.
If they are exercising or not, why they are not exercising, because I need to take their hands and walk together.
Yes.
I cannot
Please, go ahead.
I cannot let them alone, because the outcome won't be good.
Definitely, as a surgeon, I can see a huge difference between patients without any preparation and the patient that started the preparation with you, you know, for the surgery. Definitely, everything it's pretty different nowadays, you know, with the correct preparation. I think it makes the whole difference. Definitely, I can see that in terms of getting better scar, in terms of getting better recover, in terms of getting better shape. You know, the whole difference. It's not only the surgery. You know, so again, I don't think the surgical process to just, let's say, cut the skin and give some stitches. Anyone can do that.
That's impressive.
Anyone can do that. Honestly, anyone can do that. Okay.
And also to mention that the patient also needs to prepare their homework.
Yes.
Okay, it's not only one way to get the things done. Okay, I need to do my part, you need to do your part, the patient needs to do their part.
Definitely.
Okay, so it doesn't matter. I know that sometimes it's not the patient's fault, like when you have like menopause or a problem in the metabolism way. It's not their fault, but I need to inform them that something is happening, and they need to be aware that that thing needs to be fixed. Even after the surgery, some cases we can manage, but in cases that we feel that it will be a huge problem, going for the surgery and dealing with the high surgical distress, the recovery, the healing process would be a nightmare.
A little bit far, but here's my heart for you. I would like to appreciate all this that have been doing this journey with me. It's amazing. It's great. I cannot have a better person on my side than you. Thank you very much. You know, we have been a really nice couple at this moment, working together. You know, living together.
Welcome very
and
much.
Everything is amazing on your side.
I just miss Dr. Amy, our assistant. She quit job.
Dr. Amy, she doesn't want to be doctor anymore. Now she's into the music and other
into
things.
The music field.
And
okay,
the music
guys,
fields.
see you next time on the next podcast.
See you guys. Bye bye.
See you.